Most people over 60 take vitamins because they want to protect their health. They have read the labels, heard the recommendations, maybe even discussed it with a doctor at some point. And the assumption underneath all of it, the assumption almost nobody questions, is that vitamins are safe because they are natural, because they are sold without a prescription, and because the body is familiar with them. That assumption is not entirely wrong, but it is wrong enough to cause real harm. Because what the nephrology research, the science of kidney health, keeps finding is that specific vitamins and supplements, taken at the doses most commonly recommended on supplement bottles and in online health content, can be quietly damaging the kidneys of adults over 60 in ways that do not produce obvious symptoms until the damage is already significant. A quick note before anything else. I am not your doctor, and this channel is for general education only. Nothing here is medical advice, and nothing in this video should lead you to stop taking any supplement without first speaking with your physician or pharmacist. What I want to give you today is a clear, research-based picture of 7 specific vitamins and supplements that carry documented kidney risks after 60 days, risks that most people buying them at the pharmacy have never been told about. Stay with me through number 3. It is the supplement that has been marketed most aggressively to older adults for bone and joint health, and the mechanism by which it damages kidney tissue is something the research has been documenting for over a decade, while the marketing has continued completely unchanged. Before we get into the list, tell me your age in the comments and how many supplements or vitamins you are currently taking daily. I read every comment, and your answers help shape what this channel covers next. Here's what changes about kidney function after 60 that turns ordinary supplement doses into a potential problem. The kidneys are the body's filtration system. They remove waste products, excess minerals, drug metabolites, and water-soluble vitamins from the blood. They do this through roughly 1 million tiny filtration units called nephrons. After age 40, we lose nephrons at a rate that accelerates with age, and by the time most people reach their late 60s and 70s, kidney filtration capacity, measured as glomerular filtration rate, or GFR, has declined by 30 to 40% from its peak, even in people with no kidney disease on record. This matters enormously for supplement safety. When the kidneys filter at full capacity, excess water-soluble vitamins, mineral metabolites, and supplement byproducts are cleared efficiently. When filtration slows, these substances spend longer in the bloodstream and in kidney tissue. They accumulate. Some of them, in high enough concentrations, damage the nephrons directly. Others trigger inflammatory responses in kidney tissue. Others form crystals, literal crystalline deposits that lodge in the tubules of the kidney and cause scarring. And because the kidneys do not have pain receptors in the way that muscles or joints do, this damage accumulates silently, producing no symptoms that most people would notice until kidney function has dropped to a point where standard lab tests begin to flag it. Think of the aging kidney as a filter running at 2/3 capacity. A substance that passes through the full capacity filter without incident can, when the filter is slower and more congested, build up to concentrations that begin to damage the filter itself. That is the central risk this video is about, and it applies to 7 specific vitamins and supplements that are being taken by millions of older adults today. The 7th item on this list is high-dose vitamin C, ascorbic acid R, taken as a standalone supplement, typically at doses between 1,000 and 2,000 milligrams per day, which is the range most commonly recommended on supplement labels and in online health content. Vitamin C from food, from oranges, bell peppers, broccoli, strawberries is not the concern here. The concern is high-dose supplemental ascorbic acid consumed in a form and quantity the body was not designed to handle efficiently. Here is the mechanism. When the body metabolizes vitamin C, one of the primary byproducts it produces is oxalate, a compound that the kidneys must filter and excrete. At food-level doses, the oxalate load is modest, and the kidneys clear it without difficulty. At supplemental doses of 1,000 milligrams or more per day, the oxalate load becomes substantial. In the kidneys, oxalate binds with calcium to form calcium oxalate crystals, the same crystals responsible for the most common type of kidney stone. In older adults whose kidneys are already filtering more slowly, these crystals can accumulate not just in the collecting system, but within the kidney tubules themselves, causing a condition called oxalate nephropathy, JETSOIC's direct, often irreversible damage to kidney tissue. A 2021 study published in JAMA Internal Medicine, analyzing data from more than 23,000 adults, found that high supplemental vitamin C intake, specifically doses above 1,000 milligrams per day, was associated with a significantly higher risk of kidney stones in men and a measurable increase in kidney stone risk in older women. A separate 2022 case series in the Clinical Journal of the American Society of Nephrology documented multiple cases of acute kidney injury directly attributed to high-dose vitamin C supplementation in adults over 60, several of whom had no prior kidney disease. The body's maximum daily requirement for vitamin C is approximately 90 milligrams for men and 75 for women. The kidneys are equipped to handle perhaps 2 to 3 times that. Beyond that range, particularly at the gram-level doses found in many popular supplements, the oxalate burden becomes a genuine risk. If you are taking high-dose vitamin C, ask your doctor about the appropriate dose for your kidney function level, and ask specifically about an oxalate risk assessment. Number 6 is a supplement that has been heavily marketed to older adults as essential for immune function, wound healing, and cognitive health. Zinc. Zinc is a genuinely important mineral, and mild zinc deficiency is real and worth correcting. The issue is that the doses commonly found in zinc supplements, 25, 50, even 80 milligrams per tablet, dramatically exceed the recommended daily intake for adults, which is 8 milligrams for women and 11 for men. And chronic zinc excess, particularly in adults over 60, produces a specific and well-documented kidney risk through a mineral competition mechanism. When zinc is consumed in excess, it competes with copper for absorption in the gut, and it wins. Chronic high-dose zinc supplementation reliably depletes copper in older adults, and copper deficiency, in turn, impairs the function of an enzyme called superoxide dismutase, which is one of the kidney's primary antioxidant defenses. Without adequate superoxide dismutase activity, the kidneys become more vulnerable to oxidative stress, the cellular damage caused by free radicals that accumulates during normal metabolic function and that the kidneys are continuously exposed to. A 2016 review in the American Journal of Clinical Nutrition documented that supplemental zinc at doses above 40 milligrams per day produces measurable copper depletion in older adults, and that the kidney injury associated with this pathway is often detected only on formal kidney function testing. There is also a more direct concern. Zinc accumulates in kidney tissue at higher concentrations than in most other organs, and excess zinc has been shown in multiple in vitro and animal studies to be directly toxic to kidney tubular cells at sustained high concentrations. If you are taking a zinc supplement, check the dose. Anything above 25 milligrams as a daily supplement, outside of a specific short-term therapeutic course under medical supervision, is more than the aging kidney was designed to process continuously. Number 5 is one that is going to surprise a large number of people because it has been positioned for years as one of the safest and most beneficial supplements an older adult can take. Vitamin D. And it is important to be precise here because the relationship between vitamin D and kidney health is genuinely nuanced. Vitamin D deficiency is extremely common in adults over 60 and is linked to bone loss, immune dysfunction, muscle weakness, and cardiovascular risk. Correcting a genuine deficiency with appropriate vitamin D supplementation is beneficial and appropriate. The problem arises with a pattern that has become extremely common in recent years. Older adults taking high-dose vitamin D, 4,000, 5,000, even 10,000 IU per day, based on online recommendations, popular health books, or well-meaning advice from friends without monitoring their blood calcium levels. Here is why this matters for the kidneys. Vitamin D's primary physiological role is to increase calcium absorption from the gut. When vitamin D is taken at high doses and blood calcium rises, a condition called hypercalcemia, the kidneys are tasked with excreting the excess calcium. Over time, chronically elevated calcium excretion leads to calcium deposits forming in the kidney tubules, a condition called nephrocalcinosis, and to the formation of calcium-containing kidney stones. A 2019 analysis published in JAMA Internal Medicine found that high-dose vitamin D supplementation, specifically doses above 2,000 IU per day taken without monitoring, was associated with meaningfully elevated urinary calcium excretion in older adults and with a progressive decline in kidney function over 3 years in a subset of participants. A 2021 report from the American Society of Nephrology documented multiple cases of significant kidney damage, in some cases requiring dialysis, directly attributable to vitamin D toxicity from unsupervised high-dose supplementation in adults over 65. The safe range for most older adults without a physician-monitored deficiency protocol is between 1,000 and 2,000 IU daily, with periodic blood testing of calcium and vitamin D levels. If you are taking more than 2,000 IU per day without your doctor's oversight and without regular blood monitoring, this warrants a specific conversation at your next appointment. Number 4 is a supplement that has exploded in popularity over the past 5 years, particularly in the older adult market, and whose kidney risks have not kept pace with its marketing: creatine. Creatine monohydrate is primarily known as a muscle-building supplement used by athletes and bodybuilders, but it has been increasingly promoted to older adults for its potential benefits in combating age-related muscle loss, sarcopenia, and for cognitive support. There are genuine emerging findings supporting some of these benefits in older adults. The kidney concern, however, is not theoretical. Creatine is metabolized into creatinine, the same compound the kidneys filter and that physicians measure on standard blood panels to assess kidney function. When creatine supplementation is ongoing, blood and urinary creatinine levels rise, not because the kidneys are failing, but because the substrate load has increased. In an older adult with already reduced GFR, this increased creatinine load can overwhelm the filtration capacity, and in people with early or undiagnosed kidney disease, creatine supplementation has been documented to accelerate kidney function decline. A 2018 review in Nutrients examined the available evidence on creatine and kidney function and concluded that while healthy young adults with normal kidney function can generally tolerate creatine supplementation safely, adults over 60 with any degree of reduced kidney function, even the mild reduction that is essentially normal for their age group, face a meaningfully elevated risk of kidney stress from creatine loading. If you are over 60 and interested in creatine for muscle or cognitive support, the appropriate first step is to have your kidney function formally assessed with a GFR test before starting supplementation. Number 3 is the one I mentioned at the opening. It is a supplement marketed heavily to older adults for bone strength, joint health, and inflammation reduction: high-dose fish oil, specifically omega-3 fatty acid supplements taken at doses of 3 grams or more per day. Fish oil at moderate doses, 1 to 2 grams daily, has a favorable evidence base for cardiovascular and inflammatory benefits. The kidney risk emerges at the higher doses that many older adults are taking, often based on recommendations that more is better. At doses above 3 grams per day, omega-3 fatty acids have a documented anticoagulant effect. They thin the blood in a way that at high doses can impair normal clotting. In the kidneys, which filter enormous volumes of blood under constant hydraulic pressure, impaired clotting capacity can lead to microhemorrhages, tiny bleeds within the glomeruli, the filtering units of the kidney. Over time, repeated microtrauma to the glomeruli produces glomerular scarring, a form of kidney damage that is cumulative and largely irreversible. A 2020 review in the Journal of Renal Nutrition documented that high-dose omega-3 supplementation, above 3 grams daily, produced measurable changes in kidney perfusion and glomerular pressure in older adults, and that these changes were most pronounced in individuals with pre-existing reduction in GFR. Additionally, in older adults who are also on blood thinners, warfarin, aspirin, clopidogrel, high-dose fish oil compounds, the anticoagulant burden significantly, a drug supplement interaction that is rarely flagged at the pharmacy unless the patient specifically asks. 1 to 2 grams per day is the evidence-supported range for most older adults. Beyond that, the kidney and bleeding risks begin to outweigh the additional benefit. Number 2 is a mineral supplement that is sold in virtually every pharmacy and health food store in the country as a remedy for leg cramps, muscle tension, sleep problems, and bone health: magnesium, specifically at high doses. Magnesium is genuinely important, and genuine magnesium deficiency is common in older adults, particularly those on diuretics or proton pump inhibitors. The concern here is not magnesium at appropriate doses. The concern is magnesium at doses of 500 milligrams or more per day, amounts found in many popular combined supplement formulas taken by older adults whose kidneys are filtering at reduced capacity. Healthy kidneys regulate magnesium excretion dynamically, adjusting how much is excreted based on how much is circulating. When kidney function is reduced, this regulatory mechanism becomes less precise, and excess magnesium can accumulate in the blood, a condition called hypermagnesemia. In mild cases, hypermagnesemia produces the fatigue and muscle weakness that many older adults already attribute to other causes. In more significant cases, it depresses neuromuscular function, slows the heart, and in severe cases, can cause life-threatening cardiac and respiratory depression. A 2017 review in Therapeutic Advances in Drug Safety specifically flagged high-dose magnesium supplementation as an underrecognized risk in older adults with reduced GFR, noting that the threshold for toxicity is significantly lower in this population than in younger adults with full kidney function. The recommended daily allowance for magnesium is 320 milligrams for women over 30 and 420 for men. Supplemental doses above those thresholds should be taken only under medical guidance if any kidney function reduction is present. And the number one vitamin on this list, first because of how universally it is taken, second because of how little awareness exists around its kidney risk in older adults, and third, because the dose at which the risk begins is significantly lower than most people would expect, is vitamin A, specifically preformed vitamin A in the form of retinol, found in high-dose vitamin A supplements and in many multivitamins formulated for older adults. Vitamin A is fat-soluble, not water-soluble. Unlike vitamin C or B vitamins, which the body can excrete excess quantities of through urine, fat-soluble vitamins accumulate in tissues, and the kidney is one of the primary sites of accumulation and activation of vitamin A metabolites. When preformed vitamin A is taken at doses above 10,000 IU per day, an amount found in some older multivitamin formulations and in most high-dose vitamin A supplements, it begins to accumulate in kidney tubular cells at concentrations that are directly cytotoxic, toxic to the cells themselves. The damage is insidious because it accumulates slowly, without symptoms, until tubular function has been compromised enough to show up on blood tests. A 2015 study in the American Journal of Kidney Diseases found that chronic high-dose vitamin A supplementation was associated with tubular dysfunction and proteinuria. Protein in the urine, a marker of kidney injury, in older adults with risk increasing significantly above 10,000 IU daily. For context, the recommended daily intake for vitamin A is 700 micrograms for women and 900 for men, approximately 2,300 to 3,000 IU. The tolerable upper limit set by the National Institutes of Health is 10,000 IU for adults, with the caveat that this threshold is lower in older adults with reduced kidney clearance. If your multivitamin contains preformed vitamin A, retinol or retinol palmitate, check the IU amount. And if you are also taking a separate vitamin A supplement, ask your doctor whether your combined dose warrants a kidney function check. Here is what all 7 have in common. They are not dangerous by nature. They are dangerous in the context of the aging kidney, a kidney that filters more slowly, accumulates more, and can no longer protect itself from excess the way it could at 40. The 7 to discuss with your doctor are high-dose vitamin C above 1,000 milligrams for oxalate accumulation and crystal nephropathy, high-dose zinc above 40 milligrams for copper depletion and direct tubular toxicity, high-dose vitamin D above 2,000 IU without monitoring for hypercalcemia and nephrocalcinosis, creatine supplementation for creatinine loading in reduced GFR kidneys, high-dose fish oil above 3 grams for glomerular microhemorrhage and anticoagulant burden, high-dose magnesium above 400 milligrams for hypermagnesemia in reduced function kidneys, and high-dose preformed vitamin A above 10,000 IU for direct tubular cytotoxicity. Not one of these needs to be stopped today without medical guidance. Every one of them deserves a conversation, specifically a conversation in which you bring your full supplement list to your doctor, Ask for a GFR test if you have not had one recently, and ask whether any of your current supplement doses need to be adjusted for your current kidney function. Which of these 7 are you currently taking? Tell me in the comments. Your answer may be the most important thing someone else reads today. And please share this with anyone in your life over 60 who takes vitamins without knowing what the research says about kidney safety. The video coming next covers the 3 blood tests that can reveal early kidney stress before standard panels catch it. Tests your doctor can order today that most older adults are never offered. Watch that one next. Take good care of yourself. You are worth the effort.